In a recent COVID-19 study conducted on 300 patients, researchers investigated the effectiveness of combining standard care with homeopathy. The results were shocking. Let's dive into the details. As we all know, the COVID-19 pandemic has had a significant impact worldwide. The disease has presented with a wide range of symptoms and severity levels, from mild to severe. With the lack of specific antiviral treatments for COVID-19, researchers have been exploring various therapeutic options, including repurposed medications and complementary approaches like homeopathy. At the beginning of the SARS-CoV-2 pandemic, the Ministry of Ayush in India recommended the use of homeopathic medicines as an adjunct to standard care for COVID-19 treatments. This study we're discussing today aimed to explore the efficacy of homeopathy as an additional treatment for COVID-19 patients. The study was a randomized, placebo-controlled trial conducted on 300 adult patients aged 18 to 80 years old of both sexes admitted to a designated COVID-19 treatment hospital. Patients were screened based on certain criteria, including a positive reverse transcription polymerase chain reaction test for SARS-CoV-2. It is important to note that, although patients were symptomatic, patients with severe heart, lung, kidney, brain, blood diseases, or other important systemic diseases, patients on ventilatory support, immunocompromised patients, pregnant women, and lactating mothers were excluded from the study. The participants were randomly divided into two groups: the standard care plus homeopathy group and the standard care plus placebo group. Both groups received the standard care of the hospital as per the prevailing recommendation of the state government for COVID-19. This standard care was given for 5 days. However, this protocol was modified as per the requirements and patient prognosis. Medicines were also given for symptomatic management of cough and pain, etc., as per the symptoms of the patients. Antihypertensives, antidiabetics, and others were given to patients as per the need of the individual case. In the standard care plus homeopathy group, patients received homeopathic medicines alongside standard care, with the specific medicine chosen based on the individual's symptom profile. The medicines were prescribed in the centesimal scale of potencies, and in some cases, as per requirements, more than one homeopathic medicine was required and used one after another based on relationship between the remedies. Complementary medicine follows well medicines or intercurrent remedies. In the standard care plus placebo group, patients received placebo alongside standard care. Here are the baseline characteristics for the different groups. The homeopathy group had a total symptom score of 26.73, while the placebo group had a total symptom score of 17.40. Here we look at the disease severity. It's important to note, classification of patients was done according to their presentation into mild, moderate, and severe as per prevailing guidelines. Mild disease was seen as symptomatic patients meeting the case definition for COVID-19 without evidence of viral pneumonia or hypoxia. Moderate disease was seen as adolescent or adult with clinical signs of pneumonia, fever, cough, dyspnea, fast breathing, but no signs of severe pneumonia, including blood oxygen levels of greater than or equal to 90% on room air. Severe disease was adolescent or adult with clinical signs of pneumonia, fever, cough, dyspnea, fast breathing, plus one of the following: a respiratory rate of greater than 30 breaths per minute, severe respiratory distress, or blood oxygen of less than 90% on room air. So as we can see, the homeopathy group had 56 mild cases, while the placebo group had 73 mild cases. 84 moderate cases were seen in the homeopathy group, while 66 moderate cases were seen in the placebo group, and severe disease was seen in 11 of the homeopathy group and 10 of the placebo group participants. Here we can see some coexisting conditions across both groups. If we go ahead and look at the vital signs of both groups, the average pulse of the homeopathy group was 93 and 90 for the placebo group. Respiratory rate was 19 for the homeopathy group, 18 for the placebo group, and the average blood oxygen levels are seen here. 95 of the homeopathy group had pneumonia, while 76 of the placebo group. Here are some other symptoms. So if we look at these symptoms in totality, it seems that the group that was assigned the homeopathic remedy as well had a greater number of additional symptoms with their COVID. There are some symptoms, for example, throat congestion, that more people in the placebo group experienced. And we can go ahead and look at the laboratory findings, the blood test results. We won't go into this much, but if you would like some more detail, you can pause the video here and have a look through it. The primary outcome measure was the total symptom score over a period of 10 days, with clinical recovery being the main goal. Secondary outcomes included the time to fever clearance and time to clinical recovery. Time to fever clearance was defined as time from the first dose of the drug until the temperature dropped to less than or equal to 37.5 degrees Celsius and remained below this temperature for at least 48 hours. The body temperature of patients was recorded every 6 hours. Time to clinical recovery was the time from enrollment until the total symptom score became 0. The study found some interesting results. Firstly, the primary outcome, the total symptom score, showed a significant decrease in the standard care plus homeopathy group compared to the standard care plus placebo group over the 10-day period. This indicated that the addition of homeopathy to standard care had a positive impact on symptom improvements. Furthermore, the standard care plus homeopathy group experienced earlier recovery by 2 days compared to the standard care plus placebo group. Fever resolution also occurred 20 hours earlier in the standard care plus homeopathy group. On day 10 of treatment, 75.5% of patients recovered in the homeopathy group compared to 36.91% in the control group. This graph depicting the trend of recovery between the two groups shows the odds of patients becoming symptom-free was 8 times higher in the standard care plus homeopathy group than the standard care plus placebo group. After 5 days of treatment, a significant number of patients in the standard care plus homeopathy group got rid of symptoms. So overall, the addition of the homeopathic care added a significant benefit to those patients. 40 homeopathic medicines were prescribed for the patients. These medicines were selected based on the individual patient's symptom profile and response to treatments. This table describes the 13 most frequently prescribed remedies and what symptoms may have led to those selections. Arsenicum album, bryonia, and phosphorus were the top 3 most prescribed remedy. Arsenicum album was prescribed to 15 patients. Symptoms that may have led to this selection may have been intense anxiety, restlessness, a fear of death, along with fever and weakness. Bryonia alba was prescribed to 12 patients. The key symptoms that may have led to this prescription would have been intense body aches and pains that were aggravated by motion and relieved by pressure or lying still. Phosphorus was prescribed 12 times. A persistent violent cough leading to hoarseness or nosebleeds may have led to this prescription. Rustox was prescribed 10 times. Some keynote symptoms may have been some body aches and stiffness with restlessness that were relieved by motion and worse for initial movements or after rest. Natrum muriaticum was prescribed 9 times. Some keynote symptoms may have been a watery or runny nose with clear discharge but with a sensation of dryness, including headache and fatigue. Hepasolf was prescribed 7 times. Some symptoms that may have led to this prescription would have been extreme sensitivity to cold, a loose rattling cough that was especially worse in cold air. Pulsatilla was prescribed 7 times. In these patients, there would have been changing or a shifting pattern of symptoms, including a desire for fresh air with that dry cough that was productive and loose at night. Lycopodium was prescribed 6 times. This would have been prescribed for patients that had many digestive symptoms along with their respiratory symptoms, such as bloating and indigestion with that horse cough. Nux vomica was also prescribed 6 times. Symptoms of irritability, sensitivity to noise and light, and headache would have led to this prescription. Belladonna was prescribed 5 times. This would have been prescribed for a sudden and intense presentation of symptoms with a high fever and flushed face and a throbbing headache. Carbo-Veg was also prescribed 5 times. Some symptoms that may have led to this prescription would have been extreme weakness and prostration, combination with symptoms that were worse for cold and better for warm. Chinanim was also prescribed for 5 patients. Some symptoms of weakness and a periodic fever with chills, including a dry and irritating cough, would have led to that prescription. And gelsemium was prescribed 5 times. Some keynote symptoms there would have been a gradual onset of symptoms with weakness, heaviness, heavy eyelids, and a headache. Those symptoms may have led to that prescription. At first prescription, 67 patients received a 30C potency and 72 patients received a 200C potency. The remaining 12 patients received a higher potency. 96 patients received 1 homeopathic medicine only, while 55 patients required 2 or more homeopathic medicines during the study period. The study concluded, adjunctive individualized homeopathic management with an integrated standard of care has resulted in better clinical outcomes in patients with COVID-19 in terms of early recovery, but further double-blind controlled studies are needed to confirm these results. In conclusion, this randomized placebo-controlled trial suggests that the addition of homeopathy to standard care for COVID-19 may have significant benefits. The study showed improvements in symptom scores and clinical recovery time in the group receiving homeopathic treatment. These findings could have important implications for healthcare professionals, although more studies are required. If you would like to see a video on the details and statistics of homeopathy's role in previous epidemics such as cholera, Spanish flu, typhoid, and scarlet fever, leave a comment down below. During the Spanish flu epidemic, homeopathic physicians documented more than 62,000 patients treated with homeopathy. For people who were sick enough to be hospitalized, conventional medicine had a mortality of 30%, with 27,000 documented hospitalized cases using homeopathy. A 1.05% mortality was reported.